Welcome to Next Generation Healthcare, proudly presented by Optimal Telehealth. Are soaring health insurance costs for your family or business causing you stress? Tired of the long waits and high fees for a simple doctor's consultation? Then you found your podcast. Next Generation Healthcare is here to empower you to take back control over your healthcare decisions, freeing you from the constraints set by insurance companies. In our episodes, you'll uncover the secrets to circumventing traditional insurance to access direct services from your preferred providers at savings of 40 to 50%. This podcast is a creation of Larry Stout, the visionary founder and CEO of Optimal Telehealth. Now, let's hear from Larry.
Hello, this is Larry Stout, and welcome to this episode of Next Generation Healthcare. We've got a special guest today that's going to help answer some questions that our members frequently have about where to go when you actually need to go see a doctor or get imaging work or lab work or something like that. Where do you go to find cash pay providers, at a lower rate? So that can be kind of confusing. So we brought Lyn Carter with us, and Lynn is Director of Strategic Partnerships at Tendo Corporation. Tendo owns a company called MDsave, and our virtual primary care provider, Lyric Health, uses MDsave to assist their members in finding these cash pay sources. So welcome to our podcast, Lynn. I really appreciate you taking the time to join us.
Thanks for having me.
I frequently describe MDsave as a tool used to locate affordable medical service providers, much like GoodRx is a tool used to locate affordable prescription drugs. Tell us what MDsave is and what its value is to consumers.
Sure. MDsave is a two-way marketplace that connects up those seeking to purchase care, being consumers, with those who are trying to provide care, which would be providers, health systems, ASCs. And truthfully, our intention is to create a direct contracting environment where everyone can get the best rates possible. Think of this kind of like an Amazon for healthcare. Instead of merchants, you have providers selling their procedures. Procedures would be like the goods that you buy. And then the purchasers are going to be the patients who need care. So we've been around for about 11 years. We've got a pretty strong platform. Currently, we process about 15,000 procedures per month. And we have about 300 different bundles and about 2,000 different procedures available on the site.
Wow.
We're nationwide.
Impressive. Well, give us some idea of the scope of services. I know you can locate all types of medical specialists, but give us some kind of insight into additional resources that are available on your platform.
For sure. So first and foremost, we offer transparent pricing, like you mentioned, but we also comb CMS data, commercial insurance rates, all sorts of different forms of data to provide averages in your specific area. So even if we don't offer a procedure in an area, we do provide information to help you better shop for care as a reference point.
Okay.
Other things, we do partner with Care Credit, which makes financing a little bit easier if you're having a tough time paying for care. And really, our biggest value proposition for our scope of services is the ability to find what you need in your area and pick what you need. Which is very difficult to do in healthcare sometimes.
Great. I've also read recently that Tendo has patented technology that enables users to schedule medical procedures that have been bundled. You mentioned bundled in your previous response, that have been bundled to include all the components necessary in a given procedure. This has always been a problem with traditional insurance because and it's the main thing that causes people to be surprised when they get the bill in their mailbox and find they've been charged for things they weren't aware of. In other words, patients know up front the entire cost associated with the procedure because there's no separate bills or things like imaging and specialists that are not included that have already been bundled in. So am I describing this correctly? And if so, please expand on how it works.
Yeah, absolutely. I think all of us have gone to the ER or, had a procedure done, and you got your facility bill, you got professional bill, you got your specialist bill. So you got three bills for one whole episode, and that can be
Right.
very confusing and it can be off-putting. So
Uh-huh.
one of the unique value propositions that we offer is that we uniquely contract with each one of the members of that piece of care. So I'm going to let's use a colonoscopy as an example, right? We go and contract with the professional, so that the provider that's providing that service, with the pathology department, with the anesthesia department, and with facility. We contract
Uh-huh.
with all of those entities separately, and then we bundle all of their prices together so that when the member goes and purchases that colonoscopy, they're getting the whole price all in. Now, more importantly, from the provider side, we are very provider friendly because when we do that, we also pay each of those members individually for what's been rendered, which takes a lot of the administrative burden off of health systems, which is why we've been able to get such a strong network over the years.
That's fantastic. And it's a big step forward as far as price transparency. The government is doing a lot right now around price transparency in the medical industry. And I know our viewers are going to see more and more about that in the press as time goes on.
Yeah.
Uh, if GoodRx only displays information about, I was using a GoodRx as an example, but they only display information about what's available out there, about pricing that's available. But as you just mentioned, people who are using GoodRx actually schedule their appointments and their services right through your platform. Is that correct?
Yes. So I should say that I'll go through the process. Not unlike
Okay.
Amazon, you're looking for a specific procedure, say an MRI, right? You
Mhm.
find one in your area that you like the provider that it's at, perhaps the location is good for you. You click purchase. So you're paying for that MRI right up front. The second that you click purchase, you are sent an email with the front office staff information for who to call and schedule that with. But also, that front office staff is receiving an email saying, Larry Stout purchased an MRI. This is what he's looking for. Please reach out to Larry Stout, and here's his contact information. So it's a
Okay.
two-way street. Now, that said, some of our flagship partners that we've been with for a long time that we're strongest with have
Hmm.
actually embedded us within their EMR so that you can schedule directly onto their platform as well from MDsave.
Oh, that's great.
Yeah.
That's a super solution. Um, are there any limitations to the types of services available?
Yes. Yes. So we don't do drugs. No drugs, no pharmacy. We don't do dental. And we don't do DME. Now, we have some preferred partners that we'll redirect you to that we can say, hey, we've worked with these guys. We like the work that they do. We can, we vetted them, but we don't list any of those procedures on our site.
Okay. I mean, do you, for instance, something like maternity services, do you have that type of thing?
We do. We have maternity. We have a lot of preventive health. I'll say the strongest use that we have would be orthopedics. We're extremely strong in
Okay.
gastroenterology, imaging, lab. Trying to think of the other most common procedures. We see a lot of general surgery.
Hmm.
But yes, we're across the board. There are very few things we don't do.
Is information provided on the platform that helps the patient select a provider? I'm sure in any given area, when the members go out there to make their choices, there's going to be multiple providers in the same area. So, do you provide any information to assist their selection process?
Sure, sure. So as someone's browsing for something, they will find a provider profile. On that profile, it'll have all of the demographic information, including if they have a specialty in one side versus another, contact information, that sort of stuff. However, we are also rolling out the Tendo Care Connect quality scores, which is a proprietary quality score that takes in a lot of factors that your typical US news does not. So, for
Okay.
example, we take into account the frequency in which they complete the procedure, the frequency in which the facility they work at completes the procedure, their outcomes from those procedures, all of those things. And I understand that's being rolled out in the next few months to be displayed right alongside our pricing and the listing of our providers. Now, that said, that will be displayed in our Tendo Care Connect portal, which is to support the self-funded ecosystem.
Hmm.
It is not going to be on our traditional MDsave website for a little while longer, but it's
Okay.
coming.
Okay. Well, that actually gets into my next question. When a Lyric member calls their care team at Lyric to schedule this type of health care, kind of clarify for me, how does that health team utilize the product to support their member as opposed to the consumer going directly to the MDsave website? And just so our listeners know, MDsave is available to anybody. You can go out to the website, and just like you could GoodRx, I continue to use that as an example, but it's free. You just go out there and sign up for it, and you've got access to it. So when the members call Lyric, what does that process look like? Are you familiar with it?
Absolutely. So we've got two different verticals here. We've got our MDsave.com vertical that's been around for 11 years. And that vertical is publicly displayed prices across the board. And that's kind of where we started. And anyone
Okay.
can use that at any time. Our second vertical, we call Tendo Care Connect, and that's only been around for a few years. And Tendo Care Connect is intended to support clinical folks. So that would be like your virtual care providers, your navigators, the self-funded employer ecosystems. So, brokers, anybody who's purchasing care, but from the self-funded employer world. Here it accesses our Tendo Care Connect platform, which is a little bit different. But that said, the reason why you would want to go specifically through Lyric is because first, you've got a provider that is shopping your care for you and is sharing a cart to you. They have login access to everything that we have on the Care Connect portal, which is quite a bit bigger. And they are able to curate a cart for you that they think is the most clinically appropriate. Second, they're able to order those procedures. As you know, MRIs and a lot of labs, those sorts of things must have a physician order in order to get those completed.
Right.
So by working with Lyric, you've got a provider that's jumping in, managing your care and ordering the exact care that you need. And then they share the cart with you for you to complete that purchase.
Okay. Well, that's enlightening. Yeah. It's helpful to know how that works. That's really a pretty seamless process. Let's say a Lyric member, pardon me, a Lyric member schedules with schedule services through MDsave, and they go to the procedure, they go see the specialist, whatever it is. Of course, if I understand correctly, they pay for it up front when they schedule the services. Is that correct?
Yes, they pay for it up front. And I know where you're going with this. What happens when things don't go perfectly?
Yeah, what happens when the doctor says you need something else?
Absolutely. And that is a question that we get all the time. Anytime you do a proactive bundle, in other words, you bundle a bunch of procedures together in advance, you always leave a little bit of room for what could happen if things don't go according to plan. So there's a couple of different ways that we do it. Number one is we're going to cancel one purchase and make a new purchase. So we're swapping one procedure for another. And that can be done instantaneously. So the provider lets us know, hey, this member actually needed this instead. A great example could be going back to that colonoscopy if we find polyps as well. And so we can refund one and repurchase another. The second option would be we can add additional components to the current bundle. So again, continuing to get those savings. If that provider can complete the procedure that still needs to be done, that's perhaps changed when someone's, under the knife or something.
Right.
That's just added on. So think like adding on to your cart.
Right.
And then in the third case, the provider cannot complete what needs to be done. There's no opportunity for us to do anything different. What we would do is anything that's beyond that bundle, we can either bump into someone's insurance if they have insurance, or they can do cash pay with that provider directly. That doesn't happen very often. In fact, canceling a bundle and purchasing a new one doesn't happen that often. We have really strong relationships with our providers, and oftentimes either through us or through the provider, a lot of those differences are reconciled without needing to make much change.
Lynn, you've answered a ton of questions for my members today, and I'm sure our viewers too, when it comes to this whole process of converting to cash pay medicine. You've plugged a lot of gaps, let's put it that way. Is there anything else you can think of that might help our listeners, our viewers in that area, in your area of expertise?
I'm very passionate about cash pay medicine, and whether that's through alternative insurance or whether that's through direct cash pay, I think that there's a lot of opportunities for patients to take better care of their finances and their health through cash pay. And so it's scary for a lot of folks, for a lot of employers to step away from the traditional health model. But I encourage everyone to take a stab at it. Through organizations like ours or others that are similar to us, there's a lot of opportunity for you to find the exact procedure you need with a fantastic doctor for a fraction of the cost. And I'm sure, Larry, and several other podcasts that you guys have had, you've gone through the cost differential of if I get this MRI done via cash or if I get this MRI done via my contracted rate with Blue Cross Blue Shield, what the differences are. It's important that employers and the members of our community feel comfortable to at least try something different, because you can always jump back on a plan if it doesn't go well. But I don't see many people jumping back on to a traditional health plan after they start trying cash pay. So that's my shout out. Now, we do also have, I'd like to speak to Tendo Care Connect a little bit. Tendo Care Connect is new in the last 3 years, where we work with direct to employer models. So we're partnering up community hospitals and community health systems with the large self-funded employers in the area and the navigators in the area. So we're creating an opportunity for health systems and employers to talk directly instead of through the mouths of a carrier. And that's something that's very new. It's very exciting. That's kind of what I was brought on to talk a little bit more about when I was hired about 7-8 months ago. But I anticipate a beautiful fusion of consumer models with self-funded employer models all along this direct contracting continuum.
This has been very helpful information, Lynn. I think you're helping us create the picture we want to create for our viewers. So what we want our viewers to know, our followers to know, is that there's hand-holding throughout this whole conversion to cash pay medicine. Companies like MDsave, obviously the major providers like Lyric and Sedera, who we represent, and other companies like Take Command, you are going to have more support and guidance than you can imagine. There's you won't have any voids where you think, what do I do next? Because all of these providers that we work with are used to helping their new members go through this process. And of course, once you've been through it, it's a piece of cake. It's like it's not more difficult than insurance. It's just different. It's like switching from iPhone to Android. It's just a different process, but it's actually very simple once you've experienced it, and there's plenty of help along the way. So, Lynn, thank you so much for joining us today.
Thank you for tuning in to Next Generation Healthcare, brought to you by Optimal Telehealth. Your engagement means the world to us. If you find our content informative, follow our podcasts on Apple, Spotify, or YouTube. We welcome your participation and will review listener input in future episodes. To leave your questions or comments, access additional episodes, or browse our blog post library, please visit the resources page at optimaltelehealth.com. You may also connect with us on LinkedIn, Facebook, or Instagram for the latest insights and updates. We look forward to welcoming you back soon. Your journey towards empowered healthcare continues with us.